Do you need to renew Medicare every year? That's what I'm going to talk about in today's video. I hope you can stay tuned till the end. My name is Jamie Pripp from InsurerRates.com, and we help people understand the Medicare program and find the coverage that fits their needs. So every fall around this time, we get a lot of questions about changing Medicare plans. And people are wondering, is it something that I have to renew every year? So there's two different types of Medicare plans. There's what's called a Medicare supplement plan or a Medicare Advantage plan. And depending on which one of those plans that you have will determine whether or not you need to do anything during the Medicare open enrollment period each fall. If you have a Medicare supplement plan, that plan is guaranteed renewable each year, and so really all you have to do is continue to make the monthly premium. Now, you may want to shop that once in a while and make sure you're getting the best rate on that Medicare supplement plan, but you can do that anytime all year long. That is not connected to the Medicare open enrollment period. However, if you do have what's called a Medicare Advantage plan, then you do want to review your coverage each year. It doesn't mean you have to make a change if the plan is working out for you and it worked well for you in the previous year, then you may not need to change anything in the new year. But what a lot of people don't realize is that each year, if you have a Medicare Advantage plan, you are notified of your plan changes for the coming year with something called a Medicare Annual Notice of Change. And so, right around this time of year, you're probably getting a lot of junk mail, a lot of phone solicitations, and maybe just seeing a ton of commercials on TV about Medicare. Well, it's important to know what you should pay attention to and what you shouldn't. A lot of times, all you're getting in the mail is junk mail. A lot of times on the phone, you're getting spam calls. And obviously, with TV commercials, well, you probably change the channel or just want to mute those. But you do want to pay attention to your mail, usually somewhere around the end of September, and look for the notification on the current plan you have telling you these are the changes coming in the coming year to your plan. So what are the items inside of that notice of change? And so we're going to take a look at that here really quick. So here are some of the coverage changes that potentially might come in your Medicare Advantage plan in the coming year. There's a few things you want to take notice of. First of all, what new benefits have been added to your plan? You may have a plan that didn't have benefits this year that it's going to have in the next year. That can be a really good thing. Are there other changes that affect services you use? Have there been any changes in your health that may affect what services you may need or how often you may need them? Maybe this year it was recommended that you go to a new specialist. Well, you want to make sure that that specialist is in network for the plan that you have. If you're going to start seeing a new doctor or a new specialist, you want to make sure that the plan that you have includes that doctor. And those are some of the things you want to look for. If your health has changed, will your plan benefits cover the additional care that you need? Again, remember with the Medicare Advantage plan, there are co-payments, deductibles, and co-insurance. And so if you're going to start needing more care in the coming year, that could end up costing you more money. So you really want to pay attention to that. Next, you want to pay attention to the provider network changes. Every year there are certain plans and doctors that change, and this is another reason you really want to pay attention to this annual notice of change. So what providers have been added to or removed from the plan network? Maybe you had a doctor last year and they're not going to accept your plan in the new year. You want to pay attention to that. Again, working with an independent agency like us, we can look at your doctors and make sure that they are still in network. Also, you want to pay attention to hospitals or other providers or specialists that you may need in the coming year. And then if your providers are not in network, are you willing to switch to a different provider where that plan would be accepted? And a lot of times these are the decisions that you have to make. Another big thing is looking at the drug list and pharmacy network changes. What medications have been added to or removed from the plan's covered drug list? This is what's known as the formulary. So you want to pay attention to that. Are the drugs you currently take listed on the formulary? Medicare.gov is a great resource for some of this, but also working with an independent agent like we are, we can help you with this. Have any of your medications been assigned to a different tier on the formula? This could affect your cost. So another reason you want to pay close attention to the annual notice of change. And then finally, is your pharmacy in the plan's network? Is it a preferred pharmacy that offers the plan's best pricing? So as you can see, there are quite a few things to consider before you even get to the cost changes, like the plan premium. Is the premium going to stay the same? Is it going to go down? Is it going to go up? They'll have to notify you of that. Are there any other cost changes such as deductibles, co-payments, co-insurance? A lot of people don't realize that depending on which Medicare Advantage plan you have, you could pay more out of pocket than another person has. So you want to pay attention to that. Another big thing that we recommend is if you have a Medicare Advantage plan, what is the maximum out-of-pocket limit for the year? And this is important because let's say you need something major done next year, whether it's surgery or a hospital stay, again, you could end up paying more out of pocket. And then how will cost changes affect your total out-of-pocket spending for the services and the prescriptions that you need? So there are a lot of things to consider. And again, we understand that there's a lot of junk mail, there's a lot of phone calls, there's a lot of TV advertisements, and the temptation is to just tune out all of that noise. But you want to be careful about that, and that's why we recommend making sure that the current plan that you have, the company sent you that annual notice of change, and that you are able to review that. If you're a little bit overwhelmed by all of this, maybe you just want to speak to an agent and have them help you make sure that the plan that you're in this year is going to fit your needs in the next year, you're welcome to reach out to us. Their phone number is 800-974-0552 or visit our website at insurerrates.com. We'll leave the contact information for all of that in the description of this video. If you like videos like this, please subscribe to our channel, hit the like button, and if you have questions about Medicare, your Medicare, leave them in the comments below. Thanks so much for watching and have a great day.